the gold standard in orthodontics today. The whole idea behind it is actually pretty simple. The entire system is based on one thing: how your top and bottom first molars line up. A great way to think about it is like two gears in a machine. For everything to work right, for your bite to function properly, those gears have to mesh together perfectly. All right, so let's dive into the first classification. This is the one you'll see most often. It's called a class 1 malocclusion. And when I say common, I mean really common. Get this, a whopping 60 to 70% of all orthodontic cases fall right into this category. It's pretty much the bread and butter of what an orthodontist sees day in and day out. So here's the most important thing to get about a class 1. Those molar deers we talked about, they're actually lining up just fine. The jaw relationship is correct. Think of it like a house. The foundation is solid. The problem isn't the foundation, it's the furniture inside. The teeth themselves are all out of place. And that's what leads to all those classic issues you might recognize. Things like crowding, where your teeth are all jammed together, or spacing, where you've got gaps, or even rotations, where some teeth are twisted and facing the wrong way. Okay, but what happens when the problem is the foundation? Well, that brings us to our next category, class 2. Now, a class 2 malocclusion is what most of us just call an overbite. This is where the lower jaw is sitting too far back compared to the upper jaw. And what's really interesting here is that class 2 isn't just one thing. It actually has two very different versions or divisions. In division 1, the upper front teeth are flared out, kind of sticking forward. That creates that noticeable horizontal gap we call an overjet. But then you have division 2, and in this case, the front teeth are actually tilted backward, which often causes a really deep bite where the bottom teeth can practically disappear behind the top ones when you close. All right, now let's flip that entire picture around. On the complete opposite end of the spectrum, we have class 3. And this is what everyone commonly knows as an underbite. It's exactly what it sounds like. The lower jaw is positioned too far forward. And just like with class 2, there's a little more to the story. There's an important distinction to make. A class 3 bite can be a true skeletal thing, meaning it's genetic and in your jaw bones. Or it can be what's called a pseudo class 3, which is more of a habit, where someone just shifts their jaw forward to make their teeth fit together comfortably. So that system from Dr. Engel, the one based on the molars, that's the main framework for sure, but it's not the whole story, not even close. Orthodontists actually add several other diagnostic layers on top of that to get the complete picture. For example, they'll look past the teeth and at the jaw bones themselves. That's the skeletal classification. They also use your canine teeth, those pointy cornerstone teeth, as another key reference point. And of course, they look at how the front teeth come together to make sure the final bite is going to be stable and work properly. Each little layer just adds more and more detail to the plan. So, okay, we've just covered a lot of classifications. Class 1, 2, 3. So what does this all mean for you, sitting in the chair? Well, this is where all those pieces of the puzzle finally click together. See, by combining all of these different checkpoints, your orthodontist creates this incredibly detailed, three-dimensional blueprint for your treatment. So the main takeaway here is this. Your diagnosis isn't just some simple label like class 2. It's a complete 3D picture that guides every single decision they're going to make from start to finish.